All right, we'll go ahead and get started. Hi, everyone, and welcome to this month's Community of Practice on WASH and Healthcare Facilities. Today's webinar is focused on the role of faith-based organizations in improving WASH and healthcare facilities around the world. My name is Ryan Kronk. I'm with UNC, and we serve as a secretariat for the Community of Practice. If this is your first time, welcome. For those of you returning, it's good to see you again. So first, for our agenda for today, I'm going to give a couple of announcements and reminders. Then we'll, after a brief overview of the different ways in which faith-based organizations engage in this space, I'm going to turn it over to our speakers who are going to showcase how FBOs engage as both technical partners and service providers. We'll then turn it over to Gene Duff, who will give us an overview of an upcoming convening on faith-based organizations focused on this very issue later this spring. And then we'll close out with the Q&A. So please be sure to use the chat box to ask your questions during the presentation, or let us know that you have a question that you'd like to ask live. So next up, a few announcements. So we do have two upcoming webinars scheduled for the Healthcare Facilities Community of Practice. Our next one is in April on strengthening hand hygiene at health facilities through local production of alcohol-based hand rub. This will be on April 15th at 9 a.m. Eastern Time with presenters from IDI and at McCary University. So Nikki dropped the link in the chat, so feel free to go ahead and register for that webinar if that is of interest to you. And then in May, we will have a webinar where our very own Lucy Tantum from the Water Institute will launch a brand new evidence map that's focused on WASH and essential environmental conditions in healthcare facilities in low and middle income countries. This is a multi-year effort to kind of help ground us in this larger space and help direct the community towards effective research for policy programming and practice. And that webinar will be on May 5th at 9 a.m. We'll send a reminder about both of those webinars in the upcoming newsletters. A reminder to invite your colleagues to join the community of practice. The newsletter link is in the chat. If you haven't joined already, please get on the newsletter so you can stay up to date on the latest findings, evidence, documents, upcoming webinars, all that sort of stuff. And so finally, today, as part of this FBO webinar, we're launching a new working group as part of the community of practice. And if you're interested in joining, please fill out the form in the chat to indicate your availability for this inaugural meeting later in the month. And this working group will be a smaller subset of this overall community, focused on driving forward the faith-based organization actors in WASH healthcare facilities and creating new advocacy products and other evidence learning products to help advance these actors doing great work in this space. All right, so before we get started with our presenters, I wanted to give a brief background on faith-based organizations. As many of you on this call know, faith-based actors and faith-based organizations are critical partners for health service delivery and quality of care in low and middle income countries. And in some parts of the world, from work from Gene Duff and others, we've learned that faith-based organizations are responsible for upwards of running half of healthcare facilities in certain LMIC contexts. And they're often the only service providers. And so even if they don't run the facilities directly, faith-based organizations are often engaged as technical partners, whether for WASH or health or other sort of sectors and domains. And so while good WASH doesn't necessarily change whether or not it's a faith-based implementer or a secular implementer, the motivation and staying power of faith-based organizations is really crucial for long-term service delivery in many communities. And this is often inspired by beliefs in the importance of caring for the sick, serving the poor. So faith-based organizations' mission is often much bigger than any specific program or project. And additionally, many faith-based organizations have long-standing relationships in communities. And so I wanted to kind of briefly discuss different types of faith-based organizations and how they interact. There's obviously many types of faith-based organizations, Muslim, Christian groups, etc. There's international and local actors and so on. But one helpful way to think about their roles we have on one hand, we have faith-based technical partners. So this might be organizations like Catholic Relief Services, who will be presenting today, Islamic Relief, World Vision, Water Mission, etc. And these are faith-centered organizations that provide technical support on WASH, health, food security, education, and etc. to different communities. And on the other hand, there are faith-based service providers. So this might include, for example, a healthcare facility that's run by the Catholic Church or a larger faith-based network such as HCF. And so both play a critical role in advancing Washington healthcare facilities, and we're going to hear about from both of these perspectives today. So with that background, we're going to jump into our presenters. First up, we'll have Jean-Philippe Dubois and Francois Kangala from Catholic Relief Services. And then we'll hear from Nkata and Jero from the Africa Christian Health Association platform. And then finally, we'll have Jean Duff from Partnership for Faith and Development, who's going to present on an upcoming convening of faith-based organizations and actors focused on this issue. So after their presentations, there'll be an opportunity for Q&A. So please write your questions in the chat box. And again, indicate if you'd like to ask your question live and we can take you off mute. And with that, I'll hand it over to Jean-Philippe. Take it away, Jean-Philippe.
Thank you, Ryan. Hello, everyone. I hope you have the same sun as I have behind my window. I had to shut down my shutter, otherwise you would not see me. So welcome. And I'm introducing myself. My name is Jean-Philippe Debu. I am the Senior Technical Advisor for Water Security with Catholic Relief Services. Next slide, please. So we're here to talk about health, and health is a core program area for CRS. We implement health programs in 62 countries, working with more than 1,500 partners. And in health, WASH is a critical pillar for achieving health outcomes. First, it's about preventing infections and limiting the spread of diseases. It's essential for delivering quality primary care and absolutely necessary to protect maternal and child health. Beyond that, WASH is also about patients' well-being, dignity, and overall experience of care. We tend to forget this aspect, but it's the well-being aspect, the dignity, is an important element of WASH when we look at the level of a health facility. It's also for accompanying family members important to be able to have access to showers, to have access to a clean kitchen to cook for the family. Over the past 6 years, CRS has supported the establishment of sustainable WASH services in more than 470 health facilities. We are also a partner in the Vatican's initiative to accelerate WASH in healthcare facilities, where CRS has provided technical assistance to 66 facilities out of the 150 targeted under this initiative. Next slide, please. So I would like to start with this sustainability framework because we think that in our approach, in how we support technical assistance, it's where everything should start. To start your planning with a sustainability lens. Unfortunately, you know that it's not always the case. So that's why we want to focus on this. From the beginning, WASH services need to design with a clear sustainability lens and framework. So you can see on the left, I don't have a pointer, I think, but you can see the WASH service levels on the left. So of course, this is what we want to achieve to be able to deliver health outcomes. When we are talking about WASH in healthcare facilities, we are referring to water supply, we are referring to sanitation facilities. Hand hygiene is absolutely essential, probably voted as the most efficient vaccination. Healthcare waste management, also important in healthcare facilities, and environmental cleaning and disinfection. So here we have the package of WASH services that we want to establish and to sustain. But we cannot look only at this block, at this element. So you see the other blocks are there to remind us that to ensure that those services are sustainable, we need to address the other blocks. Stakeholder engagement, in my experience, and probably many of you, is crucial. So it's where even as a faith-based actor and supporting faith-based facilities often, but not only, we should not create islands of success within a health system that is struggling or other health facilities that are struggling. So it's important the stakeholder engagement is within our structure, but also with other actors so that we can contribute to strengthen a national health system or a more local one. Governance and policies, so this is related. When we deal with stakeholders, we deal with the government, but we deal with making sure that we implement regulations, but maybe also having some influence on regulations. Human resources and management, you can see in the picture that this was a training in the Philippines, and it's about ensuring that people gain the required knowledge and competencies to be able to plan and manage WASH services. Monitoring, learning, and accountability is also another component of importance. We need to know from where we start and how we progress, so to be able also over time to see the changes and to be able to take informed decisions. Environmental management and climate resilience. This is also of growing importance. We deal with issues like floods, issues with drought that are also increasing. So how do we plan and manage our WASH services in relation with the changing climate? Finally, finances. So finances are also essential to ensure sustainability. It's not only about the finance that we bring to be able to support capital investment, but this is the long-term financing of operation, maintenance, spare part replacement, etc. So I'm now going to hand over to my colleague François, who is going to tell you about his experience in providing technical assistance in the field. Thank you.
Yeah, thank you, Jean-Philippe, for giving me the floor. I'm François Kangela, working with Catholic Relief Services as a technical advisor for WASH in institutions. So I'm dealing with specifically all technical issues regarding our WASH, water, sanitation, and hygiene interventions in healthcare facilities and schools. So here, I'm going to share with you a few of our past experience regarding technical assistance we are providing to Catholic-run healthcare facility. So as you may know, CRS is providing a dedicated global technical expertise in WASH in healthcare facilities. And so that support focus specifically on quality, sustainability, and scaling up. So this includes using the WASH fit assessment tool at the baseline assessment and an ongoing implementation phase. So we are also supporting congregation and facility managers, dioceses, including government entities in operational planning. We are also making sure that the maintenance planning and costing for a long time is in place. Now we are rolling out the WASH fit assessment tool to try and accountability using the mWater platform to make sure that at the diocese level and facility level, they are collecting data on time, and they are making decision based on those evidence data. We are also supporting our local partners, dioceses and facility managers on reinforcing the WASH governance training and capacity building of healthcare workers. And now, what we are, after the sustainability assessment we did last year, we realized that the post-construction phase does not receive much support. And now we are supporting the local partner to establish the circuit rider models to sustain the wash services at a local level. Next. So in implementing those interventions, we are facing some key challenges, but this is some key challenges I would like to share with you. What we saw in the past is still weak institutional capacity and governance in many dioceses and facility healthcare, Catholic-run healthcare facility, and heavy reliance on external funding. There are also limited long-term planning. So most of the facilities, even at diocese level, they are only focused on capital investment instead of planning based on life cycle needs. So there is also inadequate and unsustainable financing, covering only minor repairs and recurrent costs. So we also noticed gaps in preventing maintenance in post-construction phase. And this is due to limited capacity and supply chains of wash material. There are also weak monitoring, regulation, and accountability system within with the minimal wash data for decision making. Next, please. So regarding those challenges, now we are striving to work with our local partner on steps how we can address them and deliver results. So since 2019, we are supporting dioceses and congregation across 15 countries to strengthen the wash system, even to institutionalize the wash systems within our intervention. So one of the results is we noted is in Kenya, where neonatal sepsis were reduced from 14.8% to 0% at Mutito Catholic Health Center in Kitui Diocese. Over 6 Catholic healthcare facilities now are providing clean and safe working environment with proper sanitation and hand washing stations are available. In Uganda, Malawi, and Kenya, we are now exploring with our local partner to pilot the circuit rider model, so this can strengthen the long-term wash maintenance. So another outcome we noted in the past few years is that at St. Matthias Amaler Health Center in Moroto Diocese in Uganda, the facility management demonstrated through good governance through clear roles definition, routine monitoring, and now they are performing regular reviews that protect WASH services and continue improvement. Next, please. So here we have the picture that shows in DRC where safe water at health facility creates high community impact in Itakaya Health Center. So the borehole we provided to healthcare is also saving the surrounding community. Next, please. So thank you very much. Over to you.
Thank you so much. And Kath, are you ready?
Yes, I am. Good afternoon. Next slide. So the Africa Christian Health Association platform is an organization that brings together Christian health associations in sub-Saharan Africa. We are present in more than 30 countries on the continent. And in brief, we are an organization that brings together mission health facilities and programs in different countries who nationally are organized through what we call Christian health associations. One of the things about this platform or convening is that we are able to unite health actors, faith leaders, and community champions to promote health equality and sustainable change through the different mission health facilities, communities, nationally at the national secretariats and on the continent as HCHAP. One of the things that is a common denominator for the faith-based health programs is that we exist in fragile, hard-to-reach communities. In most cases, places where we do not have the presence of public health care, and therefore the reach of the faith communities is to people that would otherwise not be able to access healthcare if we did not exist. And we have more than 10,000 health facilities on the continent. And one of the things that we say about faith-based healthcare and the work that we do is that we are not projects. We are organizations that existed, were set up a long time ago, some by missionaries and by other people based on their faith conviction. They set us up or they set up those health facilities and have continued to exist with or without funding. And therefore, we are committed to staying in those communities and continuing to offer healthcare based on our missions. Next slide. So as part of the work that HCHAP does on the continent is WASH. So we support our Christian health associations to do what they do in health in their different countries, but WASH is part of it. And we are doing WASH at the health facility and at the community. And at the facility, making sure that we assess the facilities and ensure that they have the infrastructure that is needed. We work on social behavior change, build capacity of the health workers, have in place circuit riders, quite just like what is happening with CRS in many places. We use information systems that help us to ensure that the health facilities stay at the health facility. We are doing advocacy. and peer-to-peer learning as well. So WASH at the healthcare facility, as well as the community, working with the communities. And at the community, we work not just from the community, but we link the community to the health facility and to the congregation, because one of the features we have of faith-based health facilities is that in most places they exist in what I would call a campus, where you will have a church, a school, and a hospital in almost the same place. So we are able to build our activities around that kind of campus. And so the same things happen. We are working with faith leaders in the church. We are working with the schools. We are working with community members, both on behavior change. We are developing things like sermon guides that will help faith leaders to talk about WASH. And so both at the health facility and at the community, we have initiatives for WASH. Next. One of the things that we are championing is using faith leaders as stewards for WASH systems. And one of the reasons we are doing that is because we believe that faith leaders are a sustainable system, because they're embedded within national health systems and their communities. So we have faith leaders that can reach leadership at the national level, and they exist in their communities. And as we know, they are trusted by their communities. And also the church owns the health facilities that we work with. So they are able to influence their management, as well as the behavior of communities. And also faith leaders will help us with awareness and accountability. And also because of their reach, they are able to bridge between government facility boards and the communities, and even the government at the highest level. And so we try to ensure that we are engaging them both as stewards and advocates and champions for WASH. Next slide. Faith community linkages for WASH sustainability. So the first thing is that we use health facilities as community demonstration sites, and then we use the parishes or the local churches and congregations as places where we will mobilize communities. Because as you may know, up to 90% of people on the continent affiliate to a religion, and therefore it becomes an easy way of being able to reach communities by reaching them through their congregations or their places of worship. And then the other thing that happens is that we have several radio stations, so radio stations that are owned by the church that exist. And so we can use the radio stations and the sermons in the churches to reinforce WASH messages. And then we have community engagement that helps us to promote ownership. Next slide. So what do we count as the key enablers of sustainability? One of them is ownership and accountability, ensuring that whatever initiative we have ownership and accountability, be it at the health facility or at the community. So we have to identify who the community gatekeepers are. At the facility, we need to make sure that if it's management, there is buy-in, because like we said, there are budgets and work plans that and whatever is happening at the facility, the management is in charge of that. Then technical capacity within the facilities. And if the technical capacity does not exist, then whatever we want to happen might not be able to happen. I just talked about management buy-in. And then we make sure that we're integrating with the national WASH and IPC guidelines, and not just that we are engaging with the government, both at the lower levels as well as the national levels. And we are aligning and collaborating so that the government feels supported in their efforts for WASH and IPC. And then we have continuous community engagement and visibility to make sure that we are working together. And then partnership and coordination, as I said, both with government and with everyone else that is working in the areas that we are working in. Next slide. For us, in order to embed WASH in health-based system, we try to ensure that we're institutionalizing WASH as part of uh, quality of care standards so that it does not exist as a silo. We also try to strengthen leadership capacity of faith leaders and the facility boards, and WASH is discussed as part of the agenda, and then expand community of practice for our South-to-South learning so that whatever is happening in one country is shared with the other, and through this community of practice, then people are able to learn. Because one of the things we know is that coming across funding for WASH has become quite challenging. But when people are learning from each other, one of the things we've learned is that we're able to identify innovative ways of covering those costs and being able to have the WASH standards that we want at community and facility. And then being able to deepen community partnerships for local maintenance, and also move from, like I said, projects to systems, so that we are not thinking of WASH in terms of who can fund an XYZ activities to something that is embedded in what we are doing. Yeah, next slide. Yes, I thought that was my last slide. Thank you.
Excellent, thank you. And over to Jean now.
Hi, everybody. Can you hear me okay?
Yes.
Great. Delighted to be on such interesting presentations. Thank you, Nkata and François and Jean-Philippe. I'm calling in from Ireland. I'm still wearing my St. Patrick's Day colours and greeting you all on the festival, the post-festival day. As many of you know, I see lots of friends on the participant list here. I've been working for decades now on convening multi-faith partnerships on global goals, and in particular on global health goals, including WASH. I know many of you from work at the Washington National Cathedral and the Joint Learning Initiative on Faith and Local Communities, and with the Partnership for Faith and Development. I've been part of the Band of Warriors that has been loosely known as the Global Water 2020 crew for more than 10 years now, and I'm very privileged to serve as the faith advisor. I've been asked to speak today about the so-called Road to Rome, convening faith-based organizations to drive action on WASH in healthcare facilities. And just to give a quick summary of our efforts to convene faith-based organizations with a view to collective action and to progressing action on WASH in healthcare facilities. Next slide, please. I'm just going to give you some of the highlights on the road. I can't actually see the slides, so I'll assume that I'm talking to the next slide unless you tell me otherwise, Nikki. So I'd like to just tag and many of you on the call, I think, were there or your organizations were represented, an important meeting that was held in 2019. This was the first sort of major organizational meeting, although faith actors clearly have been involved in this work since faith actors were doing work in healthcare. But this first meeting was convened in 2019, and you can see there the logos and representation of many of your organizations. Importantly, from that meeting, a wonderful collection of over 100 commitments were made by faith-based organizations and allies, the likes of the Christian Health Associations and Salvation Army and WEA and so many others, committing to advance WASH in healthcare facilities in a whole variety of ways. At the end of this slide, I'm going to offer a list of resources, including a link to the commitments report, which I think you will find interesting, at the very least as a historic record of the aspiration of faith-based organizations. May I have the next slide, please? Jean-Philippe and Francois referred to the work, the Catholic healthcare systems work, and I'd just like to give you a little bit of background on that because I think it's so important. In 2019, most of the organizations, the faith-based organizations who were represented and who were most active, were what Ryan earlier distinguished as technical partners. They were primarily NGOs engaged in various aspects of WASH, except perhaps for Salvation Army and a few others. What's really important and interesting about the Vatican's WASH and healthcare facilities is it is such a large-scale mobilization within a faith-based health system through the worldwide hospital and clinic system of the Catholic Church. So in 2021, under the great leadership of then Cardinal Turkson, who was the head of the Vatican's dicastery for promoting integral human development, an outreach was made to bishops leading the church in low-income settings, with a request to assess need in their healthcare facilities, to assess WASH need, and to provide information on that. So out of that process, 186 hospitals, facilities in low-income countries were assessed. And as you won't be surprised to know, only 35% had access to basic water service. And all HCFs needed some WASH service. Of these facilities, 150 were included in what became known as the Vatican's WASH and Healthcare Facilities Initiative. And as Jean-Philippe also mentioned, as of 2025, about 80 of these 150 facilities are actively engaged, have received funding, and are working or have already completed the work to address the gaps. So this is a very important ongoing initiative. May I have the next slide, please? Last year, there was a very interesting meeting took place at Washington National Cathedral, where folks were invited to update the progress on the commitments that they had made in 2019. And a wonderful gathering, many old faces from that time, and indeed also quite a number of new actors. So the commitments were the outcomes of that meeting. Just to summarize them, if I may have the next slide, please. What we began to see was that, inspired by the Catholic initiative, there were now commitments among some of the other religious institutions and healthcare systems to consider launching their own initiatives within healthcare networks. Most notably, the Episcopalian, or on a larger scale, the Anglican Church, the Anglican Communion, but also the Methodist and some of the Muslim participants. Corresponding and complementing what the technical partners and the NGOs were already doing. Ryan and the team announced the establishment of a community of practice for WASH, which was most welcome. And it's wonderful to see how that's growing, Ryan and Nikki. And thank you so much for your participation, continuing participation in the work, and the exciting news of the establishment of the faith-based working group. So there were a number of very positive outcomes from that meeting. And next slide, please. And again, we began to see ripples beyond the Vatican initiative, including the expansion of work on WASH, as Nakata has referred to, among the Christian health associations, both in Africa and also in India and elsewhere. We're seeing the Anglican Communion Health and Community Network now stepping forward to develop a WASH initiative in their health systems, and the United Methodist Church and the Adventists also. Next slide, please. Turning to the Rome meeting, next month in April, there will be a working meeting in Rome entitled Committing to WASH in Healthcare Facilities, a gathering in Rome of faith-based organizations and allies to accelerate progress. The meeting is being held under the patronage of the Vatican Dicastery for Promoting Integral Human Development, and we will hear an important update from them about the development of the WASH, the Vatican's WASH in Healthcare Initiative, Catholic WASH in Healthcare Initiative. It's co-convened by a wonderful group, many of whom are represented on this call today. Caritas and Catholic Relief Services have been extremely important implementing partners for the Vatican Initiative, along with some other Catholic organizations. The sisters have, of course, been hugely involved, represented here by the co-convener Daughters of Charity. And we have Quam and the Methodists, the Catholic Health Association, the Anglicans, HCAP, and also very strong representation from the Accord Network and its WASH constituency. May I have the next slide, please? The objectives for the Rome meeting, as I said, it's a working meeting. It's a meeting that is being attended by invitation, and it is prioritizing those organizations who are making commitments to continue to progress improvements in WASH and healthcare facilities. We will, so the specific objectives are to gain and encourage commitments of funding and other specific supports that advance WASH in faith-based healthcare systems. We hope to accelerate the newer faith-based WASH and healthcare initiatives, and also to spotlight the secular organizations that are performing such an important role in supporting WASH within those faith-based healthcare facilities, those technical partners. We'll hear reports on progress and key learnings and future direction of the Vatican Initiative itself. And of course, there will be a brilliant spotlight on the indispensable role of Catholic women religious sisters, who are, in so many cases, the sine qua non of delivery at the front lines of healthcare. We'll hope to demonstrate the efficacy and reach of religiously sponsored healthcare systems and networks and the value gained for global health priorities and supporting them. We'll have some potentially donors there who we hope will receive a very, very strong case for why this is a fantastic area to invest in. And finally, we want to strengthen and broaden and indeed transition the leadership of WASH in healthcare facilities among a variety of committed institutions and locations. I mentioned earlier our band of WASH warriors. The intention is to draw the functioning of that band to a close, and very happily hand the continuing progress over to so many of indeed your institutions that are on the call today, and to organizations like UNC Water Institute Community of Practice. So it's hoped that the tremendous progress that's already underway, that momentum can be carried forward, and that the need for the band of warriors will diminish. Next slide, please. So just to show, and I'm sure that Nikki, you'll be able to make this available, the slides available to everybody. The resources that we've mentioned here are available for your downloading and access. I'd be happy to take questions when the time comes. Thank you so much.
All right, thank you so much, Jean. Thank you to all our presenters. As she mentioned, please feel free to drop questions in the chat or raise your hand. And if you'd like to ask your question live, please do so. Now we've got 15 minutes to work through those. I have pulled a few questions from the chat to start. We have one from Fred Tasabe. It looks like it's to the CRS team. And Fred asks, as CRS is currently supporting Catholic-based healthcare facilities, I'd be interested to know how sustainability is being assessed beyond the directly supported facilities. In practice, Catholic patients may also access services in non-Catholic healthcare facilities. Has there been any consideration of extending sustainability, planning coordination, or selected support mechanisms to non-CRS facilities to promote continuity of care and broader system resilience? I don't know if Francois or Jean-Philippe wants to try to tackle that one.
I can start and Francois can complete. I don't. Oh, sorry. Okay. Yeah, I would say that I don't have a magic answer, but one component of the sustainability framework on which I insisted to start with is the stakeholder engagement piece. And this is where we consider that we are not in our Catholic group working only for ourselves, with ourselves, but really to try to engage other stakeholders. So it takes time. It's easier to put in place systems when you work within a group, for sure. But what we try to promote is to be able to drag support, to engage others, to come with humility and not give lessons, but really to try to create interest for systems that we are trying to put in place. And it's only through this collaboration that we can have an impact at scale. So it's what I would mention. Work on stakeholder engagement, try to create interest for what you do, and maybe it's the way to go beyond our own organizations or networks. Over. I don't know if Francois wants to complete something.
Yeah, just to add that in terms of a sustainability assessment tool, we are using a scoring assessment tool based on agenda for change building blocks. So when we are assessing the sustainability aspect, we are considering all stakeholders involved in facility functionality, the government entities, the community, the wash operators, and so on. So in Catholic teaching, when they set up a facility, health facility or school, so there is no discrimination for who may use the facility. The people who will be using the facility are not Catholic. So the facility is for everyone. Over.
Great, thank you so much. We've got another question from Rob Overley. One of the issues that I have faced with my faith-based partners is the tension between different faiths and the equity of providing services throughout the population being served. How can that be remediated? If any of the panelists would like to respond to that one.
I can try to. Well, I have to say that when I work with the faith-based health facilities, I haven't come across that. But one of the things I know is that it's a real concern in communities because we have different religions. But I think one of the things that help when we serve communities is to help people understand that we are faith-based. And it's the values we have as faith-based organizations that drive what we do. However, we offer our care without discrimination to anybody. And being able to help your partners understand that they need to offer their services without discrimination. And in many places, for example, when I talked about sermon guides, one of the things we do is that even if we are the Africa Christian Health Association platform, we bring in the Muslims, for example, in Nigeria, and we will develop sermon guides using theologians from both the Christian and Muslim faith and make sure, because we understand that that community specifically is almost 50-50, and we make sure that when we work in a community that has both faiths, then we are serving both by making sure that whoever is in that community that is served by the faith leaders that are in that community. So I think it's helping partners to understand that our values is what drives our mission. However, when we do the service, it should not be discriminating.
Thanks. Any other comments from the panelists? All right. If not, I've got another question. Christy from World Vision was asking, could any of the presenters speak to how they're engaging specifically around meaningful and quality inclusion and access for persons with disabilities? I often observe that as a gap in some facilities, especially in rural areas. Any thoughts on that one? Sure, go for it. Please.
Often if I understand well the question, it's about access with people who have like mobility issues. And unfortunately, I think that what we often see are technical solutions. There are ramps to access the toilets or larger toilets, which is important, but the solution or the problem requires also more than that. You can see a ramp to access a toilet block when in fact it's not even possible to reach with a wheelchair to the bottom of the toilet block because the ground is not practical. You cannot practice it with a wheelchair. So it requires also more like a system approach to see how people can have access to the health facility, not only to provide like a physical access to the facility itself, to the sanitation facility, for example. So it's really a matter of social inclusion, of how to plan services considering the needs of people who have some impairs, but not only to focus on the facility and let's say the technical solution. It's often a matter also of social exclusion that is bigger than only a technical arrangement or solution. Over.
Great, thank you. Any other comments?
Yeah, I would like to add that the issue of people with limited mobility is also a key question of wash fit assessment tool. So where the monitoring system is well established, it is among the key indicators. So, and when the result published, so the facility can consider this as a weakness and they can plan to address this issue in building a toilet that can meet people with the disability needs in terms of sanitation. Over.
Great, thank you so much. Any final questions for our panelists?
I think Jean has a comment.
Yeah, great, Jean.
Just if I could, Ryan, if I could ask our distinguished participants to put in the chat any suggestions they will have for us on ways to continue to progress the engagement of faith actors in WASH in healthcare. We've seen such tremendous progress already and great engagement, but we'd love to hear from this very experienced group of folks any suggestions that you have for ways to progress the work. Thank you.
Any comments? Suppose we can carry forward the discussion in the faith-based working group if that's of interest. Good plug. I'll also mention that the Rome meeting will have some live streaming options. So if many will be able to participate virtually if that's of interest. We'll share those details soon in our upcoming newsletters. All right. Well, if there's no other comments, no other questions, I'll give everyone 4 minutes back. Fred had a comment here. Local ownership and policy support would be a good idea. And Allie raised her hand. Go ahead. I don't know if we can unmute.
You should be able to unmute, Allie. We can't hear you if you're talking. I think Allie did put something in the chat. Sorry, Allie, that we can't hear you right now. But it says, thank you so much for the good presentations. I trust that this initiative is a real impactful to the community at large on issues related to WASH. For CRS Tanzania, it's our first experience to be implementing this in healthcare facilities. We started with 2, but the demand is large. How will this intervention be sustained in Tanzania? I'm guessing this is for Jean-Philippe and Francois.
So I can go back to the sustainability framework. I think there are pieces that we need to work on together, not focus only on the services, on the WASH services, but making sure that I think many of the points were raised in the questions in the different presentation that we again, I'm sorry to go back to stakeholder engagement, but I think it's crucial to understand with whom we work. It's about, there was a comment on policies, making sure that we understand we work within a policy environment, and we have to comply with those policies and regulations. We need to understand them, maybe to have some influence. So it's all those blocks that I've presented in the slides and that you can find in the report that we will share through this webinar after the webinar, that you can look at. Are we sure that we don't forget to address some of these components? It's what we found to be like the key components of sustainability. We might not be able to address all elements, but we should not leave anything behind. So meaning that if we cannot address ourselves, we need to work with others. We need to engage others who will be able to address some of the other components. Thank you.
Great, thank you. All right, we're rapidly approaching time. So thank you all again to our presenters and for everyone who attended. Please stay tuned for updates in our upcoming newsletter from this webinar and how to get involved moving forward. But thanks again and have a great rest of your day, everyone.
Thank you. Bye.
Thanks. Goodbye.
Thank you, everyone.